I grew up in Macon, Georgia. I was born here, born at the medical center, and ended up going to Stratford from the time I was 8 years old and graduated from there. Went off to college in Virginia at Washington and Lee. Went to medical school at Medical College of Georgia and did my residency at the University of Virginia. I did a sports medicine fellowship in Jackson, Mississippi at Mississippi Sports Medicine, and came back here in 2007. I got interested in orthopedics when I dealt with some orthopedic injuries playing sports growing up, and ended up having surgery when I was a senior in high school from Dr. Sapp, and got to know the group, Making Orthopedic in Hand, which is now OrthoGeorgia. Back then, got to know some of the doctors, and they became my mentors, and I ended up working during the summers with this group in physical therapy and in the operating room, and that's where I became passionate for orthopedics. You know, my sports medicine fellowship, we took care of a lot of the colleges in Mississippi and the junior colleges and the high schools, and so much sports medicine is about having a relationship with the high schools and the colleges and some of the athletic teams, and so it was a fairly easy transition for me to start taking care of some of the high schools and the colleges around here. So I've ended up being the team doctor for First Presbyterian Day School, and help out with Windsor and Piedmont Academy in Monticello, and I help out with Mercer University's soccer teams and football teams. I love college football, and that's just a passion of mine. I'm a big Georgia fan, and have always loved college football. But I played soccer growing up, so I've enjoyed taking care of the Mercer men's and women's soccer teams. The way it was described to me by one of my attendings when I was starting fellowship is fellowship is sort of like giving you 10 years of experience before you get started in your practice, and I think that's a pretty good way of describing it. I was well trained after my residency, and I would have been fine to practice at that point, but I ended up doing about 1,100 cases in 1 year when I was in Mississippi, and so obviously that amount of experience was invaluable to making me more comfortable, to making me more educated, and just I didn't really feel like I saw much that I hadn't seen before after that high volume that last year fellowship. So it was extra training, and definitely it was specialty training where I was doing much more complex stuff as a fellow than I was even in residency, where we did a lot of complex surgeries and diagnostic medicine in residency. When I was growing up here, there weren't as many orthopedic surgeons, and fellowship wasn't as important back then. Most orthopedic surgeons were not fellowship trained, and so they didn't do the complex surgeries that we do now and the complex pathologies that we do now, unless they were at some big academic center. Well, you know, when I grew up here, there were probably only 5 or 6 orthopedic surgeons, and they were very general in their practice. I think now we have in our group 20 plus surgeons who a lot of them are fellowship trained and are extremely specialized in very complex parts of orthopedics. So I think there's not really a need to go to Emory or down the road to Jacksonville or Columbus, because we have all the specialists here that you really need, and we're as trained as those guys are up there. I looked at a lot of different, I loved Virginia, so I definitely looked at a lot of jobs around Virginia. I almost went back to University of Virginia to practice. Almost went back to Jackson, Mississippi to practice where I was in fellowship. But I think coming home was important to me, and honestly, the skill and the practice in OrthoGeorgia was so impressive to me that it was kind of a no-brainer to come back. It was just an ideal situation for me. I felt like the practice was growing, and I felt like I caught it on the upswing, and Dr. Thornsberry and Dr. Floyd and some of these guys who were my mentors, it was a real honor to be asked to be partners with those guys and to have them bounce ideas off of me and me be able to bounce ideas off of them. So that was a very unique situation for me to be able to come back and practice with these guys I respected so much. I think OrthoGeorgia is unique in the sense that we have so many doctors, yet all of us are trained from very different residencies, from very different parts of the country, and have very different training backgrounds. And so even though, say, Dr. Thornsberry and Dr. Lee and Dr. Pope and I all do very similar, take care of very similar pathologies in orthopedics, we have very different ways of looking at the pathologies, and so you can get a lot of different opinions on how to do the different surgeries or how to treat the different pathologies that we see right here in these walls. So I think that's a very unique situation. I've been to a lot of places where half of the group has been trained at the same residency or have very similar fellowship backgrounds, and I don't think that's necessarily a good thing. I think we all have been trained at very different places and by very different surgeons, so there are a lot of different ways to skin a cat, and I think we've all been exposed to a lot of different ways.